Innovation, imagination, wonder. These are just some of the words used to describe Dr. Harvey Passes. Dr. Passes explores interesting people and ideas that will stimulate you. He questions the people who develop, create, and employ novel concepts in business and everyday lives. He especially loves to speak with successful people. How did they do it? How can you do it too? So let's join Dr. Harvey Passes in his quest of wonder and curiosity as we watch Dr. Harvey Passes Presents.
Boy, have I got an interesting, wonderful show for you today. We're going to take a little journey away from visiting all around Long Island and seeing its wonderful bounty of food and wine and agriculture and talented people doing creative things. We're going to go to an area right now. Well, get ready for this one. Sit down, get a pencil and paper, because you're going to want to take some notes. If you or someone you know has cancer or has come in contact with cancer, this is the show for you today. I decided that I wanted to bring to you a full understanding of the nature of cancer, what it's all about. And I am very fortunate to have as my esteemed guest today, Dr. Kanti Rai, who is the chief, who is the director of hematology and oncology at Long Island Jewish Medical Center. And he is also the Joel Finkelstein Cancer Foundation Professor of Medicine from the Albert Einstein College of Medicine. This is a very knowledgeable expert in the field, world-renowned, and he has been so gracious to take my invitation to come down and help us understand what it's all about. Dr. Rai, thank you very much for your extremely busy schedule. I know you just came back from New Amsterdam, and you're exhausted from lecturing and talking, and good to have you here.
Thank you very much. It's a pleasure to be here and see what we can do in the next few minutes.
Well, let's do it. Let's start off by asking you this question. This is the toughie. We got to start off with the toughie. After this, it becomes easy. Why is there terror? Why is there fear? Why is there awe, and not the good kind of awe, that people have when they hear the word cancer or someone says it to them? You have cancer, or your loved one has cancer.
Well, I think that it is quite understandable, because the word cancer in the minds of our communities, societies, individuals, groups, speaks for death. And who likes to have the aura of death hanging in their homes? And therefore, there is a certain degree of understandable awe and fear and anxiety related to the very word cancer.
Absolutely. Without you going into great detail, because we're going to save that for a few moments from now, just a brief yes or no. Should people have a sense that there is hope, that when someone says you have cancer, that it is not curtains, that it's potentially not a death sentence? Is there any hope at all today?
Yes.
Good. We're going to get into that in a few moments, because I want the people to understand. Otherwise, turn off the set and forget it. At least there is.
Right.
So that's very important. Is cancer the same whether it affects one part of the body or another? That's because there's different types of cancer. Talk to us about that.
No.
It's different.
Right.
Please explain.
All right. You said...
Well, I meant just with the other part.
Okay.
Take me too literally.
Cancer, when it affects one organ, means something completely different from the same term affecting another organ. Let me give you an example.
Please.
That when a cancer is diagnosed in lung, the method of progress, development, and infiltration and movement towards worse and worse situation for the individual person.
The
Invasion, you're right, is much more active than the same term given, let's say, to cancer of
Basal cell?
basal cell.
Like a very
this
skin cancer.
People can have it removed. They go to a dermatologist or a plastic surgeon on a regular basis, and they live on and on 95% of the time. Whereas the lung cancer moves and infiltrates, if that is not a too technical term, faster and therefore kills.
So the big problem is if the cancer is one of an invasive nature, if it wants to have its army and just start riddling your body, as opposed to it just kind of staying localized?
Exactly.
Okay?
Quite right.
Okay, so that's the first thing that someone has to understand. What are the various types of cancer? Are there various types, or is there one cancer?
Oh, there are a number of types of cancers. And without becoming too technical,
Okay.
One basis of separating cancers of different types are what cell, because the cells in our body are extremely differentiated. That there are some cells which are of the vascular endothelium, that is the inner lining of our blood vessels, other cells which are part of our stomach and colon and intestines.
Muscles.
Others are of muscles. So the origin of the cell is one type of classification. The second type, and from a layman's point of view, much more understandable, is the organ that is affected by cancer.
Like the stomach, for example.
Like a stomach. A stomach cancer has a completely different biology, method of progress as compared to cancer of colon, because of different types of multiplication and proliferation of those cells.
And it would be also different than lung or
Of course.
melanoma.
So that different organs in the body having cancer will denote different types of prognosis, and therefore they can be classified as cancer of the ovary, cancer of the uterus, cancer of prostate, and doctors know what to make of it, and even general population now knows
Get an
what
idea.
to make.
So each organ winds up having its own personality and its own signature, and the doctor who's knowledgeable enough understands all that and works within that knowledge.
Exactly.
Okay, so that's very interesting. Do all cancers kill within a few months? Or people can live on with cancers, or what?
No, not all cancers kill within a few months. That is totally wrong. I would say that there are certain cancers which kill faster, and other cancers. For example, let me give you a much more practical example. A person with prostate cancer
Right.
does not have to have, as you said in your introductory remarks, treat that diagnosis as a death sentence. Some people go on and live their entire natural life expectancy and die of old age or hip fracture or car accident. They die with prostate cancer in a large proportion of patients, whereas lung cancer or advanced metastasized colorectal cancer or pancreatic cancer are known to be killers in a short order.
So it takes me to the next discussion, and that is, what does it mean when someone says the difference between early detection? Does that really make a life and death difference between early detection?
Absolutely.
Amplify that.
Because if you consider any kind of disease in our body and its potential to cause danger and risk either to the quality of our life or the quantity of life, then it is easy to understand that if it is truly a localized in a certain part of colon, let's say, and a good cancer surgeon can go in and remove it, making sure that all of it is removed and the margins are also clean. Well, and sometimes it may be necessary that after the surgery you give some additional treatment, radiation or chemotherapy. But then that small localized cancer is, for all practical purposes, should be considered cured. Whereas if you have a tumor which is larger in size and it is not surgically resectable, then it makes a difference. Then it will spread and kill.
Because you just can't get to it.
That's why.
Like a cancer of the esophagus, for example? Am I correct that that's a lot more difficult to operate on, or today it's become easier?
It is becoming easier, but your example is right. My example would have been breast cancer.
Okay.
A woman with a small tumor, which can be removed by surgery, will have a high or significantly high chance of being cured, whereas the same woman being diagnosed with a larger tumor, which most likely also has spread to the lymph glands of the area.
We're still talking about the same breast. Okay, same breast cancer.
So
right?
I'm going to the theme of your question about early detection. And does early detection mean a difference of life and death? So the same woman is more likely to die of breast cancer in a matter of several years if it is not picked up soon
Undetected,
enough.
right?
Whereas if she had been picked up with the cancer a couple of years earlier, she would probably be cured or curable. So it makes a big difference to the individual.
I am looking, as you're speaking, I'm looking at cancer as an army that starts with just a small little group of scouts that come out looking into, they're going to start a war. And they just see, the general sends out just a few, and they look around, and then they start embedding themselves, and they start, come on, we can keep going. And little by little, it keeps growing and spreading and spreading. But if you get those little guys, and they come in early detection, and boom, hit them, get rid of them somehow. Whether you extirpate it, whether you cut it out, or whether you bombard it with some kind of medication or radiation, at least you're getting those little guys. Before then, they start doing their invasions throughout. I look at this as just a terrible war within your body. So if there's one thing I'm getting from what you're saying today, and let me shift right over to you at home, I want you to understand detection, early detection is the most important thing. As Dr. Rai is saying, when it's tiny and it's small, it's easier to take care of than when it's big and it now has overrun all the systems of your body. Now you got a problem. Go to the doctor and don't be afraid. Keep watching. We're going to continue. Will you agree with what I'm saying?
Absolutely.
Okay.
Absolutely.
So that's the way I look at it. So if a woman has so again, for breast cancer, early detection, but it should be for everything. PSAs, if you want to get a prostate exam, early detection. Are any of these early detection tests, are they painful?
No.
So people
not
shouldn't be
at
afraid.
all. Let me
Please
amplify what you just said.
Go ahead.
That, for example, American Cancer Society, National Cancer Institute, they all have come up with some suggestions to the general public about early detection. And it is critical that we emphasize those points. If you look at the most commonly seen malignancies or cancers in the American population, which are in women, it is breast, lung, and colorectal, or colon and rectum.
Women, wow.
In men, it is lung, prostate. Prostate is more frequent than lung, and colorectal. And each one of these account for the large majority of cancers in these two genders. And then, of course, there are other additional types of cancers which in absolute numbers are smaller.
Mm-hmm.
But now, breast cancer is the most important cancer in American women, whether they are white or African American. And the recommendation is that after a woman has turned 20,
Mm-hmm.
that a doctor should examine her approximately every 3 years, examine the breasts
Mm-hmm.
and other parts of the body
Mm-hmm.
for breast cancer. And after the age of 40, every year, mammograms ought to start every 3 years at a younger age, but after 40, it should be done every year.
Mm-hmm.
By these two methods only, and you add after age 30 or so, a woman being taught how to do breast self-examination.
Self-examination, right.
It can make a difference of life and death. If a woman, for example, has a family history, her mother's sister, or other women in her immediate family have had breast cancer, well, that woman ought to start all these breast self-examination, clinical examination by a doctor, mammograms, much more frequently than a woman with...
What if a woman has another kind of cancer? Let's say she has bladder cancer, and she routinely goes for mammograms, etc., and she's in her 50s. Is the fact that you've had one cancer preclude the fact that there is a high percentage chance that you will get another cancer somewhere else, or they're totally separate and distinct?
There is not too much of information on this, but more than intuitively, a person, man or woman, who has one cancer already diagnosed is certainly at a greater risk to develop a second cancer than the incidence of that second cancer type in the general population.
Okay, I understand.
But I don't want to scare
Right.
our listeners to make believe that once you have cancer, you're going to develop another cancer.
Right. Now, let's move for a moment and let's go into treatment. Are there better treatments today than there were 50, 40, 30, 20 years ago?
Oh, there is no question about this. Today, the hope for cancer patients has become such a reality that instead of, your words, a death sentence, cancer today has become a chronic disease, like osteoarthritis, rheumatoid arthritis, or any other chronic
Toothache.
Toothache. You know, you are a dentist. Toothache is a chronic. It should not be chronic.
Absolutely.
But it is the reason for change in the outlook for a patient now known to be having some kind of cancer, from imminent death to a chronic condition, is because of better treatment. We are diagnosing people more and more because of our pressurizing people to go for early detection, and B, because we have better treatment, that we have a scenario where cancer has become a chronic disease.
It's always been synonymous. If you say chemotherapy, say someone has breast cancer or ovarian cancer and they have to go through chemotherapy, it's always been synonymous. Chemotherapy means nausea and vomiting. Nausea and vomiting, hair falls out. Is that still the same today, or have things gotten a little bit better in the course of treatment as far as these side effects are concerned?
I would say more than a little bit improvement.
Oh.
Well, first of all, nausea and vomiting in 2006, in today's age, ought not to be allowed to happen to any person.
Wow, that's a
man
heavy
or
statement. Wow.
Today we have such effective drugs, and not one, but I can
Multiple.
think of half a dozen drugs, and used properly by oncology or cancer nurses and cancer doctors, I think nausea and vomiting has been eliminated in virtually 95% of cases of chemotherapy with cancer.
What about hair loss?
Hair loss is another matter. Hair loss is something which we have not entirely succeeded in preventing. Although most of the drugs that we use today do not cause baldness, but a significant minority of drugs still cause significant hair loss. But the good part of it is that once the chemotherapy course is over, for example, a woman getting adriamycin, Cytoxan, and Taxol will lose her hair, but after 6 months, when the treatment is over, then within the next 6 to 12 months, the hair start to come back, and more often than not, better hair than what the woman started off.
No kidding. So there's something good from this besides a cure. What about people going through treatment? Can they then resume after treatment is finished a normal life, or has their lives now changed? Can they have sexual experiences again? Do they have problems in just functioning as a normal human being?
Now, they in most of the cases, after getting through treatment for cancer, people are able to resume their normal life. They can return to their professional or family responsibilities and sexuality. Sexuality, as you can well appreciate, has a lot of psychological aspect. So that even if from the physical point of view, a man having gone through chemotherapy or a woman having gone through chemotherapy ought to be able to resume their sexual relationship. But because of the trauma, of the anxiety, of what they have gone through for first at the time of diagnosis and the shock of that, second going through the actual unpleasant treatment, and third, after all of that, you are so afraid, you are grateful that you are alive, that you are afraid. If it is a man, husband, dealing with a wife who has gone through breast cancer, is hesitant in approaching that area from erotic or sexual point of view, and it is completely understandable. Similarly, a wife whose husband has gone through some chemotherapy, not necessarily just for prostate, but colorectal, ought to be able to approach her husband in a normal manner in terms of arousal, etc. But there is always a psychological aspect, holds her back, holds him back. And that is where I want to tell you that in today's day and age, a person with cancer ought not to limit himself or herself just to a radiation oncology, surgical oncology, and medical oncology, but all those professionals must refer the person to a psychiatric oncologist and psychiatric social worker who can together bring it back to them. Not, it is very critical that if we are cancer survivors, I would like to make sure that I have complete return to normal activities, sexual, social, family, professional. And we have, over the past years, emphasized all others and neglected the sexual and psychosocial.
I'm so pleased to hear you say this, because you're looking at this thing 360 degrees. You're presenting it to me a global appreciation of the treatment of cancer, no matter what it is, and that's wonderful, because you truly are portraying hope in comparison to the way it has been portrayed in years past. I do want to make one thing, feel like Richard Nixon, one thing perfectly clear, and that is that this show, we're focusing on cancers, but there are two distinct type of cancers, and one is, as you called it, a solid tumor and a liquid tumor. And what is a solid tumor is what? And don't tell me a tumor that's solid, and that's the answer. Just briefly differentiate between the two.
Well, it is easy to explain, because a tumor of organs, such as breast, prostate, colon, lung, those, or skin, those are the tumors which are growths, growths. And those are the ones that, if they are small and early detected, they can be surgically removed.
So that's a solid tumor.
That is a solid tumor.
We only have about 2 minutes left. The liquid tumor, in differentiation to that, is what?
Liquid tumor is, just take blood. All right, blood is liquid, flowing through our arteries and our veins. And if a cancer develops in the cells which are circulating in our blood, which, as you know, originate from bone marrow, which is the factory where all the blood cells are manufactured, or lymph nodes or lymph glands or the spleen. If a cancer affects the cells in the liquid circulating blood, that is a liquid tumor, such as leukemia, lymphoma, Hodgkin's disease, multiple myeloma, Waldenstrom's macroglobulinemia, a mouthful of a word. Whereas all other organs that we have just talked about are solid tumors, lung, breast, prostate, colon, etc.
So that's interesting. It's important that people have a good understanding of that. We're going to be doing another show, you and I, sometime very soon, and that will be on liquid tumors, to discuss it, to understand it, so that people get a better appreciation between these two shows. Because I think we've covered an awful lot of ground, and we're just about out of time. And I do have one great question that I'm going to ask you, but I think that I've got only 1 minute left, so I'm going to save that question for the next show that you and I do together. I want to tell you, we're out of time. Dr. Kanti Rai, I want to thank you very much for coming down and making the discussion of cancer understandable. Any 15 seconds, any parting comments?
Well, my parting comments is that there is hope, and we are making cancer a chronic disease and not a death sentence anymore. Thank you.
Thank you very much for those unbelievable, hopeful, progressive words. Thank you very much. I look forward to you coming back again.
I look forward to that. Thank you.
Great guest. And I look forward to you coming back again, because I try to bring you information that you can use. So, Dr. Harvey Pass is saying, whatever you do, surely do it with passion. So long for now.